Hello everybody, my name is Dr. Asa Frey, and today we are going to be talking about the top 5 reasons to do a water fast. Again, my name is Dr. Asa Frey. If we haven't met before, I'm a doctor, founder along with my wife, Dr. Joanna Frey, from Clinica Back to the Garden. All right, this is a chronic disease reversal clinic in San Juan, Puerto Rico. We have a residential center in San Juan as well as an outpatient center. Just give me a quick thumbs up if you guys can hear me okay. Good. Hello, El Mejor Limber. Very good name. Love that. If you guys can hear me, just give me a thumbs up so I can keep going. Yes, everything's sounding. Yes, thank you. You all can hear me. Okay. Hello, everybody. So let me share this on my page first so everybody can get it. Hello, Robert. How are you? Welcome. All right, I'm just going to share this real quick. So our clinic, people ask us a lot what exactly it is that we do in our clinic. And it is actually pretty simple. As doctors, hello Ali, how are you? As doctors, we believe that the first thing that a physician should be doing is taking the time to identify what exactly it is that is causing the problem, the disease, the symptom, the syndrome, and addressing that cause. And when you do that, and eliminate the cause of the problem, then you can try to build health on from the ground up. But if you do not address that cause and you're using a lot of other remedial approaches, then you really never get the results that you want. Okay, let me post this to my own page. Ok, so yo puedo hablar en español, pero hoy yo necesito explicar todos en inglés porque es más fácil para mí. No tenemos 5 horas para la charla hoy. Ok, so yo espero que todos puedan entenderme en inglés. Tú puedes escribir en español si tú quieres. Pero yo voy a hablar en inglés, okay? I just said that I'm going to speak pretty much in English because it's much easier for me and I don't have, 3 hours for the lecture. Yes, lots of thumbs up, but thank you very much. But if you want to, go ahead and write your questions in Spanish and I'll do my best, okay? So first, what we want to do is talk about what exactly a water fast is. Okay, our experience fasting, we have about 6 years of fasting experience, and it began at a center called True North Health Center in Santa Rosa, California. This is the largest fasting facility in the world. They have about 50 or 60 people fasting there at one time. Our facility here is much smaller, but you're going to get the same type of care. It is a very, very similar model to that of True North Health Center in Santa Rosa, California. What exactly is a fast, right? When I talk about water fasting, the first thing that everybody does right after they get the terrified look on their face is they say, water? That's all you're going to drink is water, right? Well, there are many types of fasts, right? And usually, most people have undergone some type of fast, right? They've done an intermittent fast, or they've done a juice fast or a sustained fast, okay? An intermittent fast would be, which is very popular on social media as well as many practitioners, and it can be quite useful sometimes. This is where you limit the feeding window during the day. So you wake up and maybe you don't eat breakfast and you wait until 12 o'clock to have your first meal. Is everybody following me, yes? And so you limit the feeding window so you don't eat until 12 o'clock and then you only eat food from 12 to 6. Okay, this would be an intermittent fast. But really, an intermittent fast is only as healthy as the food that you are eating during that feeding window, right? So if you fast from dinner up until lunch the next day, and then you start eating a bunch of food that is really not part of a healthy diet, dead decaying animal flesh, lots of animal products, cheese and milk and butter and lard, and processed foods such as oils and refined sugars and flours and salts. Well, none of those foods are part of a healthy diet, so I wouldn't recommend eating those anyway, and they certainly wouldn't be healthy while you're intermittently fasting. A sustained fast, which is very popular in Puerto Rico. Dr. Chacon did not come up with the idea, but he has sort of popularized the just eating potatoes and carrots. Sustained fast is where you just take one type of food and you eat that food specifically for a certain period of time. It could be potatoes and carrots, but it could also be broccoli, or it could be spinach and bananas, or it could be rice and beans. Okay? There is also a juice fast. And a juice fast is where you drink juice. Hopefully it's just fruit and vegetable juice, and that would be a juice fast. But the difference between all those types of fasts and what I am talking about today is what? What is the difference between all of those fasts and a water-only fast? It's a very simple answer. Come on, we had enough of you. We had 36 people here. Nobody can answer that question. The difference is, hello, Brian. How are you? Brian's an old friend of mine. Welcome. The difference is that during a juice fast or a sustained fast or a intermittent fast, you're eating, right? You're consuming food, right? And the physiology is completely different when you are eating and when you are not eating. So a water fast would be defined as complete abstinence from food or drink except for pure water in an environment of rest. Now, being at rest is incredibly important in this equation, because if you are not at rest, you will double your caloric utilization, you require more calories, your body needs to get them from somewhere, the physiology changes completely. The rest is half of the equation. So yes, you're not eating, you're taking water, but you're also in a resting environment. The patients at our facility are in a restful, very tranquil environment where they don't have to do anything. They can lie around and do nothing if they wish, and we monitor them very closely as they get well. So what's next? Everybody following me? Yes? Everybody understanding everything? No questions yet? The first thing that we need to talk about, right, is a little bit about safety. Okay, so if you are a very, very healthy person, you have a fantastic diet, you don't take any medications, thank you for all the thumbs up, I like those. And you are not trying to address a specific symptom or a condition or a syndrome, right? These types of people, it's certainly safe, and you have my blessing to go ahead and fast for a day, 2 days, 3 days at the most. Okay, this is a perfectly healthy thing to do. You can do it anytime you want, and you really don't require any medical supervision while you're doing that. Just, hello, Derek. How are you? Hello, Tamara. Bienvenidos. So you're perfectly welcome to do that. Just go about taking water for those couple days and you'll be perfectly fine. If you are taking any medication that you cannot stop abruptly, or if you are trying to address a specific symptom or condition. Most people who undergo a fast are trying to obtain some sort of results, right? They're trying to address their gastritis or their rheumatoid arthritis or their constipation issues. We see lots of patients with high blood pressure issues, diabetics, heart disease patients, cancer patients, autoimmune disorders. If you are trying to address any of these things, you really should look for an experienced professional who knows what they're looking for and has experience in water-only fasting. Okay? we have about 6 years of water fasting experience. We've fasted over 600 patients between my wife, Dr. Joanna, and I. And there are certain scenarios that arise during a fast. Most of them are perfectly normal, right? There's a variety of symptoms. Symptoms can range from anything from nausea to high or low blood pressure, orthostatic hypotension, which is lightheadedness, vomiting, skin rash. There are many different types of symptoms. However, most of them are perfectly normal, and an experienced professional will understand that, and he will just let you ride it out, and everything is okay, and you'll be fine, and we'll check you in a couple hours. However, some of those scenarios are very dangerous and do require appropriate medical attention, and you need someone who is experienced, who knows what they're looking at, or else you're going to get yourself into trouble. Okay? So I'm going to start, but how am I sure that I have perfect health? There is no such thing as perfect health. What you want to make sure is that you're living healthfully, right? Hello, Nicholas. How are you? We haven't spoken in a while. What you need to be sure is that you are living a healthful lifestyle, which means you're doing very radical things like eating a healthy diet, going to bed on time, avoiding toxic poisons like alcohol and cigarettes and marijuana and other drugs, as well as doing some exercise. Okay, those are the three main components of healthful living. So, I'm going to go over the top 5 reasons that you should do a water fast. And we are going to start with number 5. Okay, number 5. Give me a thumbs up if you guys are still with me, huh? Everybody still here? Nobody's sleeping yet? Okay, so number 5 is decrease your risk of early death. Okay, so the fifth reason that you should do a water fast is to decrease your risk of an early death. Now, what exactly is it that I'm talking about? Well, if we look at the leading causes of death, the leading causes are what? What are the leading causes of death? You guys need to do some sort of interaction here so we can keep you awake. What are the leading causes of death in the United States as well as Puerto Rico? They're very simple. About 350,000 people die every year of what? Of heart disease, right? Heart disease, cancer is a close second in Puerto Rico, and diabetes is a close third. It doesn't really matter which one is first. However, we will focus on heart disease, cancer, and diabetes sort of all together. So our most sensitive indicators of all-cause mortality happen to be blood pressure, right? Blood pressure. So by looking at our blood pressure, we can actually tell, it is the most sensitive indicator to tell us how early you are going to die, right? I know that's something scary to think about, but that's our most sensitive indicator. So based on your blood pressure, we can tell how early it is that you're going to die. Giovanni, do me a favor and ask that question at the end so I can answer that. I'll take about 6 or 7 minutes to answer all your questions at the end. Just let me get through this, because if we stop, it's just a lot of information. So what decreases blood pressure, right? How do you normalize your blood pressure? Most people, not most people, 1/3. Okay, so we have 44 people here. What's 1/3 of that? I'm not really good at math, but that's around 15 people, right? So around 15 people that are watching are patients that have alta presión, or high blood pressure. Okay, and those patients are taking medication to lower their blood pressure, right? So what can you do to lower the blood pressure? Well, you can do many things to lower the blood pressure a little bit, right? You can lose some weight. For every kilogram of weight that you lose, you have a 1.4 drop in systolic blood pressure. You can do some exercise, right? You can get rid of alcohol You can also take medications, right? You can change your diet to a vegetarian diet. That will help. You can change your diet to a vegan diet. That will also help. The medications can drop your blood pressure on average around 12 points. Okay, 12 points. That's not very much, but they do work in lowering the blood pressure about 12 points. The normal blood pressure medications are diuretics or ACE inhibitors or beta blockers, and these medications are specifically targeting certain organs. So they are poisoning specific organs, the kidneys in order to let out a bunch of fluid, the heart in order to weaken the heart muscle so it doesn't contract as vigorously, or the artery, the muscle in the artery wall, so that relaxes, okay? But the medication is specific poison for each of these organs, and they come with consequences, right? There are consequences to taking medications as well as supplements, right? And consequences sometimes for high blood pressure medications are what? You get a hacking cough, you are nauseous, you can get fatigue. One of the biggest ones for males is erectile dysfunction. Many patients who get on high blood pressure medication find that they can't achieve an erection anymore, and that, that's a big problem for us males. One of the probable consequences is sudden death as well. So everybody knows that, I hope you know, that if you do take blood pressure medication, every time you take that medication, there is a risk of sudden death, okay? Which sounds terrifying, but most of the medications have that possible consequence, okay? What actually lowers the blood pressure? And here's where I talk about fasting, right? There was a study done at the True North Health Center with the help of T. Colin Campbell, who is the author of the China study. They did a study involving 174 patients, all of them with high blood pressure, all of them on medications, many of them in stage 3 hypertension, which is advanced hypertension. And during the study, how many of them do you think eliminated all need for medication? So there's 174 patients on the study. They bring them in to the center, they give them a healthful diet, and then they fast them, and then at the end of the study, which lasted anywhere from a week to 21 days, how many of them do you think achieved a normal healthy blood pressure and did not require any medication? How many of them? There's 174 people in the study. So 100% of them, so 174 of them were able to achieve normal blood pressure. That's right, all of them. And they no longer require medication. That is a 37-point drop in blood pressure on average. On average, a 37-point drop in systolic blood pressure, that is more than 3 times of the effect of any medication. That is the largest drop in blood pressure ever found, ever demonstrated in any study. With stage 3 hypertensive patients, which are patients who have very advanced hypertension, these patients get a 60-point drop on average in their blood pressure. 60 points, and that's not including the effect of the medication, okay? And make sure everybody understands this. So when you have high blood pressure and then you take medication, the medication lowers the blood pressure. So we've gotten all of these patients off their medication and then lowered their blood pressure. So that's a 37-point drop on average and a 60-point drop on average for stage 3 hypertensive patients, not including the effect of the medication. And I know what you're going to ask: how do you maintain this healthy blood pressure? Well, they did a follow-up on these patients, and it turns out that it's fairly easy to maintain healthy blood pressure as long as you do very radical things after the fast, like eat a healthy diet, go to bed on time, and do some exercise. And it doesn't require a lot of exercise. You just need to be somewhat active during the day, maybe a couple times a week. Okay? So that is how you decrease your risk of an early death. That was number 5. I'm going to move on to number 4. Everybody happy with that? Give me a thumbs up. Number 4, the number 4 reason that you should do a water fast is to do an actual detox. So detoxification is a very popular word nowadays. It's being thrown around a lot. And what we usually see at our office, patients come in and they tell us that they've already done a detox, right? And what they've actually done is that they went to the store or they went online and purchased some products, right? They've purchased some powders or pills, and they take them, right? You follow the directions on the back, you mix the powder in the water, and you mix it together, and then you drink it, and that's supposed to, force your body to do some detoxification. Yes, Michelle, answer that question when I'm finished. Multiple sclerosis is a condition that can absolutely benefit from water fasting. We see that a lot in our clinic. But I'll answer that specifically. Actually, in number 3, I can answer that question for you, okay? So, where was I? Detoxification. Now, detoxification is something that your body does on a regular basis, or at least it should do that on a regular basis, okay? The only way to augment the process or to make it faster or more effective is to allow your body the right environment to perform those functions, right? What exactly is that environment? This is an environment that is favorable for the process, the metabolism process and elimination of these toxic products, right? What kind of environment is that? Well, number 1, it's an environment that is restful, right? Rest is a very key component in that, and water is the other component. So what we get with fasting is we get, number 1, you're resting your body and your brain and all of your organs, but you're also resting the entire digestive system. The digestive system takes up about 85 to 90% of all the energy that your body makes. So your body is churning out energy, right? And 85% of that energy is used to digest, assimilate, and eliminate waste products, all right? That's all the energy that's used just in the digestive tract. Now, when you rest the digestive tract, what happens to all of that energy? What happens to all of that energy that you were just using to digest and break down food and assimilate food and draw that food into your cells and excrete cellular waste? All of that energy can now be utilized in what's called detoxification, okay? And the toxins that people speak of, where they're simply intermediary byproducts of metabolism. And I know that's a confusing sentence. It basically just means that when through your metabolism you're ingesting a bunch of chemicals from the outside and your body creates endogenous chemicals from the inside, such as uric acid. From the outside you get chemicals such as BPA and phenols, dioxins, and your body also ingests and creates excess cholesterol and arterial plaques. I mentioned uric acid already, heavy metals such as mercury and lead and aluminum. During a fast, your body is in a very favorable environment to metabolize, process, and eliminate these materials. And only during a water fast can you really augment the detoxification process. I really don't recommend going out and wasting your money on pills and potions and powders in order to force your organs, force the liver to spill out liver enzymes or force the gallbladder to contract vigorously. These products don't work very well. As always, health doesn't come from pills and potions and powders. It comes from healthful living. Right? Health comes from healthful living, and that is what we practice here at the clinic. So that number 4 was to do an actual detox. Number 3, the number 3 reason that you should fast, and this is where I'm going to answer that question about multiple sclerosis, okay, is to normalize the gut microbiota, okay? I'll say that again. Number 3 is to normalize the gut microbiota. Hello, Jose. Hola. How are you doing? Hey, Carl. How are you? So what does that actually mean? There's a big fad today, as well as buying detoxification products, but there's also, everyone is talking about probiotics, right? Probiotics. You need probiotics for this, you need it for this, you need to augment the amount of healthy microbial, the microbial amount, the quantity of healthy microbes in your intestines. Why are we actually saying this? Well, I think we're looking in the wrong place when we immediately jump to taking probiotics. What we need to think about is, why do you think that you need help with your microbiota, right? Why is it that you think that you need to take a pill in order to help your microbiota? And why does it need help in the first place, right? So here is how the bacteria inside the gut work. The bacteria need to eat just like humans need to eat. And where does the bacteria get their food? Where does the bacteria get their food, right? They get it from the food that you put in your mouth, right? On Thanksgiving, you stick a bunch of turkey and sweet potatoes with marshmallows and oil and everything else fried in oil and a bunch of meat and dairy products and dead, decaying, rotting flesh product, and you put that into your mouth and down in your gullet, and now the bacteria are forced to digest that food. Now, different bacteria enjoy eating different food, right? Have you ever gone to the fish market, right? Have you ever, has someone ever put a dead fish in your car and left it there for weeks? Right? Even after a day, the fish starts to smell terrible. That's called putrefaction, right? That is what happens to the dead, decaying flesh products that you put into your stomach and small intestine. Okay, those products begin to putrefy. And in order to digest those products, your body needs to allow undesirable bacteria to grow inside your intestines in order to digest those foods. Okay? And when your intestines, specifically the large colon, is full of these undesirable bacteria, then there is simply no room for the other bacteria to grow, nor is there any type of food that the good bacteria like to eat. So, before you take your probiotic, it is necessary for you to find a practitioner who is going to take the time to investigate and find out what exactly is your problem. Maybe it's not a problem with your intestinal bacteria. And there certainly are tests that you can do to find out what is in there, the ambiance, the environment inside your small and large intestine. There are ways to figure out what the microbial load is down there. So, a fast, right? So these undesirable bacteria can injure what's called the endothelial lining of the intestines, right? You have a skin that goes on the inside of your mouth, and it goes down your esophagus, and it goes into the stomach, and around the stomach, and then it goes into the small intestine, large intestine, and then it goes out, right? It's basically just a long tube. So you have a long tube in your body that goes from your mouth to the toilet, okay? And inside of that long tube, you have skin, okay? So having undesirable, dangerous bacteria in your intestines will certainly injure the endothelial lining inside your intestines. Other things that injure this lining are excess of caffeine. Many different drugs injure this lining, including antibiotics and steroids and ACE inhibitors, which are people use for reflux and actually many other diseases and symptoms. Pretty much any drug is going to directly affect your microbiome inside you. And so when you injure, also lack of sleep, stress, these things also can injure the endothelial lining. So the lining is supposed to be like a very thin mesh. It's only one cell layer thick. And when you injure that lining, you get these permeable holes in the lining. Okay? And now, through those holes can come undigested proteins, other peptides, and what this does is cause a cascade of reactions, immune system reactions, from the white blood cells attacking these undigested proteins, and then you wind up with autoimmune disease or symptoms of an autoimmune condition. This is exactly the same process where multiple sclerosis develops, which is an autoimmune condition which attacks the neurology of the spinal cord. But this also happens with lupus, systemic lupus, and rheumatoid arthritis, psoriasis, Hashimoto's thyroiditis, which is an autoimmune condition where the body attacks the thyroid. But this is the stem of autoimmune development. Now, if you can address the cause of the problem, figure out how the intestines got injured in the first place, and then eliminate the cause and come up with a plan to build your health back, then you can have a significant effect on many of these conditions, and that is why we see the results that we do in our clinic. Most of the autoimmune conditions that you've seen from our patient interviews, almost all of those patients have gone through a supervised fast and a supervised refeed or realimentation after their fast, and their autoimmune conditions tend to respond very favorably. So, number 3 was to normalize the gut microbiota. When you fast, you can give this intestinal system a break. So that is really the only time that the intestines get to rest and heal, right? If you have a cut on your hand and you keep scratching it, it's never going to heal, right? If you keep pouring caffeine and alcohol and other food down in your intestines, the endothelial lining is really never going to heal sufficiently, and so you'll continue to have issues. So the only way to sufficiently normalize the gut microbiota and heal any intestinal permeability would be to do a supervised water fast. Okay, we move on to number 2. Okay? Yes, I'm happy to receive a warm tropical hug from Puerto Rico. If you're not here, you should get here. It's super warm right now. Actually, don't come right now. Wait 2 months and then come. Okay. Number 2. Okay, the number 2 reason that you should do a fast is to change your behavior. Okay, to make a behavioral change. Now, what exactly does that mean? If you're watching this, if you have loved ones that have health problems, you're probably thinking, oh yes, I should really get healthy. Now is the time to change my diet and go to bed early and start doing very helpful things. But if you've tried to do this before, right? Yes. If you've tried to do this before, you know that behavioral changes, especially dietary changes, are very, very difficult to maintain, right? Everybody give me a thumbs up if they have had that experience before or have heard that from someone. Oh, it's so hard. I can't eat that. The food doesn't taste good. The vegetables taste like gruel. It's a tasteless swill. I need to put something on them. I need to fry all my vegetables in oil and put a bunch of hot sauce and put a bunch of salt on there. I need to add the dairy product in there and fill my plate up with meat and dairy and eggs for anything to taste good, right? So dietary change is an incredibly hard thing to change and have lasting change, okay? And I can tell you from personal experience and from patients in our clinic, it makes it so much easier if you can get the good food to taste good. Now, what exactly does that mean? How do you get the good food to taste good, right? How do you get broccoli to taste good, right? Trying to convince some patients to eat broccoli before they fast is like trying to, it's very difficult. So How do you get the good food to taste good? How do you get broccoli to taste better than broccoli, right? After a fast, after 10 days on a fast, after a week on a fast, really you need at least a week to notice a really significant change. After a week or 10 days on a fast, the spinach and the kale that you couldn't eat before, the broccoli and cauliflower and carrots and peas that you couldn't eat before, the rice that you couldn't eat before without oil or salt, the beans that you couldn't eat before without oil or salt or adding lard or some other type of animal product to it, right? All of those foods are going to taste better. Why? When you do a water fast, your taste buds are able to adapt, right? With the lack of stimulation coming in from juice, from any other type of food, the lack of stimulation allows the taste buds to adapt. We call this cleaning the palate, if you will. Okay, this is neuroadaptation of the taste buds. So the brain chemistry actually does change significantly, and so do your taste buds. Your taste buds can actually regrow. So when you go back to eating, you can taste the sodium in the vegetables, right? Sodium is in almost all of the vegetables. The vegetables are full of sodium. Kale and broccoli and spinach and cauliflower, any type of green vegetable, even carrots, even fruit have sodium, okay? And this is the salty, that's where the salty taste comes from. But before the fast, you wouldn't be able to taste that, but after the fast, your taste buds have now neuroadapted, and the vegetables taste good. They taste good, and that's really important, okay? The vegetables taste good. You can taste the sweetness of the fruits, right? Mangoes and bananas and papayas and guanabana and plantain. You can taste the sweetness in the starch, too, and the saltiness in the rice and beans. You won't require frying all your food in oil, right? Sautéing is a fancy word for frying all your food in oil, right? So you won't need to use all the oils or all the salts or added sugar or other forms of stimulation to your diet, and the diet actually begins to taste good. It's an incredible thing. Another good thing is that the bad food will probably make you feel terrible, right? You go eating poor food, you go making poor food choices again after you fast, and you're not going to enjoy the way you feel. And that gives patients very good motivation to maintain a healthy diet. Okay? That's number 2. That's making a behavioral change by undergoing a supervised water fast. Number 1. The number 1 reason that you should do a fast is why? Is because fasting can save your life. I'll say that again. Fasting can save your life. The type of patient that we see in our office is a patient who has been everywhere. They have been to the medical doctor, they've been to the naturopath. Many chiropractors refer their patients to us, and thank you if you're out there. Thank you for referring those patients. We certainly persuade them to go back and see you for chiropractic care and stay with us for their chronic illnesses. But thank you for those referrals. As well as with the medical doctors and the naturopaths, we work with all types of physicians. The type of patient that we see in this office has really tried everything, okay? And they are at the end of their line. They're suffering from chronic obstructive pulmonary disease, and their clock is ticking. Their clock is ticking. The diabetes and the cancer and the heart disease are your leading causes of death. We see those all the time. And when we do the correct workup and we identify the causes of those people's problems, they tend to get better quickly. They tend to get better very quickly. People with autoimmune disorders like MS and lupus and rheumatoid arthritis, you can turn their life around. I've really never seen anything like it in my life. 6 years ago when I was at True North, the first thing that made me stop the way I practiced and completely changed what I was doing is that I actually saw patients get better. Patients with diabetes and high blood pressure and heart disease and cancer, they go to their doctors and the doctor says, oh, we're going to put you on these medications here and you're going to have to take those medications for the rest of your life because they're guaranteeing you that if you do exactly what they tell you to do, that you will never get better. You will never get better and you will continue to get sicker and sicker and sicker until you die an early death. And the process of healthful living, a supervised fast, and then a supervised realimentation and continuing living healthfully after that has really changed people's lives. You can see people get better very quickly, and that really warms the heart of any true physician. So, I hope everybody enjoyed that. Now, hello Joseph, how are you? I've spent about, 41 minutes. Okay, I've spent a long time, and I'm going to take about 5 minutes, and we're going to answer some of your questions. Okay, Janali says, my wife has arthritis, a very aggressive form of arthritis, and yeah, we can certainly help your wife. Most forms of arthritis are autoimmune in origin and stem from a problem with intestinal permeability, but there are many other factors as well. So the key is to find a physician who can take the time to investigate and find the cause of the problem, and then people tend to get better very quickly. We have great results with rheumatoid arthritis, osteoarthritis, psoriatic arthritis. Please go check out our YouTube channel and our website. It's backtothegardenpr.com. There are so many testimonials on there. Yes, fibromyalgia and conditions related to fibromyalgia. Fibromyalgia is really what they call a garbage can diagnosis. They really cannot figure out what is going on. And so we basically have to start from the roots and build a patient's health up from the bottom. And when we do that, those symptoms tend to go away quite typically. How do you treat patients in PR? Well, we have an outpatient clinic where we do long-term health programs. Okay? And we see patients, an initial visit, we see them, maybe for an hour and a half or 2 hours. Do a extensive history, a detailed physical examination. We also take the appropriate laboratory tests that we need in order to figure out what exactly is causing their problem. And then we can create a plan to really make progress. We have an outpatient clinic as well as a residential center, which is where all of our fasting patients stay, and they are monitored on a daily basis. Physician-supervised water fasting is very detailed, and we watch our patients like hawks. We knock on the door at 7 or 8 o'clock in the morning, and we take the vitals, blood pressure, pulse, temperature, weight. We ask them some questions, see what's going on with them, and then we check them again in the afternoon, and we're in constant contact with our patients who are fasting. Let's see, what else? What else here? Vitamin D deficiency. Vitamin D is actually not a vitamin, right? It's a hormone that gets produced when your skin is exposed to the sun. The very best way to obtain vitamin D is to what? Is to expose your skin to the sun, right? Sun exposure is very healthy. I know that nowadays everybody is slathering their whole entire body up with creams to avoid the sun. The sun. But sun exposure, moderate sun exposure, is very healthy. Of course, you don't want to burn yourself, right? You don't want to stick yourself in a microwave. You want to have regular daily sun exposure with most of your skin exposed. Patients down in Puerto Rico have a very easy time doing that. You just put on your shorts and your little tank top and you go for a walk in the sun. And 20 minutes is more than enough sunlight, but it should be daily. All right. What else we got here? Yes, sunbathing. Absolutely. Take sun. Right. Skin cancer patients usually have had long-term damage to their skin, which comes from constant burning of the skin over and over and over again. Right? You don't want burning of the skin. You want moderate sun exposure for 25 minutes a day is perfectly enough. For a very fair-skinned person, see how I'm a little pink? That's how you want to stay. You want to stay nice and pink. If you get red and you burn, then yes, I am taking longer than my plan. Thank you, Asa Frey. That's probably my wife. Let's take 2 more questions, okay? Right. Some of these neurodegenerative diseases, such as Alzheimer's or even Parkinson's, that cause degeneration, and you get these symptoms like ataxia. Again, there is not a cure-all for these illnesses except for identifying what really is the cause of the problem. Typically, fasting patients do very well. Tremors tend to go away during a fast, and then if you can continue doing crazy and radical things like eat a healthy lifestyle and go to bed on time and get sun during the day and exercise, then you can maintain some of these benefits. But we have seen some incredible results with neurodegenerative conditions such as those. Okay? Give me a thumbs up if you guys enjoyed today's little talk. And I'm going to plan to do this every week. I think that, well, Friday at 12 is a good time for me. If you think there is a better time, please let me know in the comments below. I'm going to leave this video up for everybody. Thank you for participating. What else? We have a live lecture on Sunday, this Sunday. It is at an Adventist church in San Juan. We have a live lecture. It's going to last about an hour and a half to 2 hours with a question and answer session. Please come. Okay, please come to that. Get on our Facebook page, check it out, and we will see you soon. Okay, everybody? Bye-bye. Enjoy the day.